Welcome to Impactful Chats. I'm Malin Martinez.
And I'm Seth Truger.
And today we're chatting with Stephanie Willding, the CEO of Community Health, which is the largest volunteer-based free medical facility in the nation. And it's located right here in Chicago. Welcome, Stephanie.
Yeah, thank you so much. I appreciate you inviting me to have this chat today.
Okay, well, really glad to talk with you. Can you start by telling us a little bit about Community Health and the population you serve or the services you offer?
Yeah, absolutely. So for 27 years, Community Health has been providing free healthcare to low-income, uninsured individuals. Today, we provide that care to more than 8,000 patients and include services like primary care, dental care, behavioral health care. We also provide on-site specialty services like cardiology, endocrinology. We have an on-site pharmacy, and we also, before the pandemic, had fairly robust group health education activities. All of those services are provided by more than 1,000 volunteers. We are volunteer-based. Around 56% of our patients are Latinx. Around 37% are white, primarily Polish-speaking patients. 4% are Black, and 3% are Asian, and all of our patients come from low-income households.
Wow, so that sounds then like a patient population that has the potential to be pretty vulnerable during the COVID-19 pandemic. How have community health patients been affected during this time?
Yeah, so the Latinx population has been disproportionately impacted by COVID-19 in a few ways. The first of which is how they've actually been affected by the virus. It's funny this question comes up because I just looked at some data this morning, and 33% of cases in Illinois and 44% of cases in Chicago were from the Latinx population. And that's extremely high, and that's with there still being some unclear data around demographics. So this virus has, it's really devastated this community. Often these are individuals who work as essential workers, who live in multi-generational homes, and who were not able to quarantine in the same ways that maybe others were. The other way that the Latinx community has been impacted during this, sorry, Seth, did you have a question?
Oh, no, go ahead.
The other way that the Latinx community has been impacted during the pandemic has been the financial and economic toll that it's taken. You know, all of our patients come from working class families, which means a missed paycheck due to a closure or due to an illness because they contracted COVID-19 is devastating to that household. You know, it impacts a patient's ability to buy groceries, to have access to the things that keep them safe, like soap and hand sanitizer and cloth face coverings. So our community has been greatly impacted by this in ways that we hadn't anticipated, particularly the financial and economic toll on the true depth of those impacts.
And how have your clinics been able to respond to support patients through this?
So community health has responded in what can really be categorized in three different ways. So the first was around continued access to care. So at the start, the onset, that first week of March of the pandemic, our goal, we decided, was to ensure that our patients did not present to an emergency department for non-COVID-19 issues. Over half of our patients have chronic disease like diabetes or hypertension. So ensuring that they had continuous access to care was really, really critical to keep them out of the ED, which was the last place anyone wanted to be. So we continued to provide some on-site care. So while other free health centers throughout the city and the state were closing their doors during the pandemic, Community Health remained open, providing on-site care with a small but mighty team that came in to provide in-person appointments for urgent care needs. So in addition to our chronic disease management, we also wanted to ensure that patients weren't going to the emergency room for something like a UTI. So we wanted to keep them out by providing that in-person care. We also, seemingly overnight, pivoted to a telehealth model and began providing the bulk of our appointments via telemedicine. So that became our primary means of care. And also access for us was ensuring that our patients had access to their medications. That was really, really key. As I mentioned, over half of our patients have a chronic condition. So medication maintenance during the pandemic was a pivotal goal of ours. So while our other service lines may have had fewer encounters, our pharmacy was busier than ever, in fact, providing more refills and prescriptions in this time during the pandemic than we did last year. So this was one of the key ways that we ensured access to care as well, as this around medication maintenance. In some cases, as a stopgap until we could see the patient again in person. Our next bucket was really our COVID-19 response. So about the third week of March, I would say, was when I started to get text messages and phone calls from leaders in the community letting me know that our target population, low-income, uninsured Latinx individuals, they were sick, they were in group settings, they were scared to get a test, they didn't know where to get a test, and they didn't know what to do. And that was really our first indication. Even before the legislators started talking about it, even before the data showed it, we knew anecdotally that the Latinx population was being disproportionately impacted by COVID-19. And we knew as a trusted, safe space for the community that we had to step up. And while we were not selected by any city, state, or federal government entity as a testing site, Community Health did go out on our own, and we launched drive-through COVID-19 testing in April. And that testing is still open, and it's now open to any uninsured adults. It's something we're particularly proud of and grateful to partners like Rush Medical Center and Northwestern for helping make that possible, because it was something our patients and the community really needed. And then the third way that we certainly had to pivot was around social determinants of health. As I mentioned, this pandemic has taken a grave economic toll on our target population. Our patients before the pandemic were individuals who were already food insecure, and a missed paycheck was absolutely devastating to them. So during the pandemic, we actually took a much more proactive approach to this. Whereas before the pandemic, we would always screen for social determinants, submit a referral, help that patient find a food bank or housing, something like that. We actually started doing some of this work directly ourselves. So we focused primarily on two areas. One was around personal hygiene, distributing bags that included soap, hand sanitizer, cloth face coverings, and when we could, shampoo, conditioner, lotions, deodorants, toothbrush, toothpaste, other personal hygiene needs. And then the other way is that we have distributed food directly to our patients. So actually just outside my doors here, in what used to be our admin space, it is now looks more like a food distribution center. And so to date, we have distributed more than 1,000 bags of either personal hygiene and or food items to our patients during the pandemic.
Wow, that is an amazing, awesome, massive response that you guys accomplished. With regard to the pivot to telemedicine and telehealth, I do wonder, given your patient population, I wonder if you experience any digital divide issues with providing the telehealth services to this population as far as access to internet or devices.
Yeah, this has been, we learned a lot during this time, but this has been the area that we are certainly learning the most about and learning, very rapidly. So just generally speaking, the digital divide hasn't been as big of an issue as we had anticipated, because when a patient does not have access to a computer, a smartphone, or the internet, we can always just do a phone visit. And typically our patients can find a phone that has enough minutes on it for a 15 to 20 minute visit. Mm-hmm. But that has been really our stopgap during the pandemic. And what we've learned is that actually telemedicine is going to play a much larger long-term role in our model of care. And we're certainly not unique, but I think that community health is unique in a few ways related to telemedicine. So for us, we've actually seen our no-show rate for our appointments decline significantly through telemedicine. And one of the reasons for this is that the barriers that our patients would normally experience in accessing care. So a working individual who has an afternoon appointment is going to have to take at least a half day off of work. They're going to have to find the transportation to get to their appointment. A stay-at-home mom is possibly going to have find childcare. There are so many barriers that our patients experience to just physically get to see their doctor that are completely eliminated if they can do a telephone or a video appointment. And so, you know, we've done a little bit of research around this. And for example, patients in our most served zip code, approximately 20% of them do not have access to a computer or the internet. So we know that that's going to be a barrier we're going to have to look into. And then the other digital divide is another way to think about it is as you grow to a true digital health model. One of the things it's on our wish list is to have at-home monitoring equipment where our patients can measure their BP, their blood pressure, their sugars, and that will report back into our system. So that's going to require training for those patients. That's going to, you know, require ensuring those patients have enough data on their smart devices or their computers in order to ensure that that data does shoot back to us. So there are many hurdles to clear, but what we have learned is that telemedicine really is going to play an important role in reducing barriers to care for our patients. And so in that way, we feel hopeful. And in fact, we recently did a voice of the customer survey with our patients and discovered that around half of our patients indicated they have both the willingness and the capability to do video visits for the long term, which was higher than we had anticipated. Yeah. So like I said, I think there's still barriers to clear, but we actually feel hopeful that this will transform our ability to increase access to care for our patients in a way that the pandemic, if not for the pandemic, it may have taken us longer to really stumble upon that.
Right.
Well, it's been really great hearing about, you know, all the wonderful work you've been doing in general and the great way you've been able to respond to the COVID pandemic to support your patients. On a personal note, when I was a preclinical med student, I was able to do some volunteering in community health, and that's, you know, always been a nice part of my formative years as a medical trainee. So really appreciate everything you're doing. Please keep it up, and thank you for joining us in Impactful Chats.
Well, I appreciate the opportunity to share about community health response. It was great chatting with you guys today.